recover from these injuries, but also just maintain a healthy foot and ankle for injury prevention. We'll talk a little bit about the virus as well, and how it relates to the foot and ankle, and then we'll open it up for questions at the end. The foot and ankle is very complicated, and it's comprised of 26 bones, 33 joints, 107 ligaments, 19 muscles and tendons, and all of these structures work together to provide support for your whole body as you kind of go through your daily activities. By the time you're 50, on average, people are logging over 75,000 miles on their feet. So it's really important for you to take care of your foot and ankle throughout your life. And the first thing you can do for that is to wear good supportive shoes, especially when you're exercising and on your feet for prolonged periods of time. If you have problems such as bunions, hammer toes, plantar fasciitis, arthritis, these are common foot issues that can get exacerbated if you're not wearing the proper shoe gear. Wearing the proper shoe gear, you know, first of all, it needs to be supportive, it needs to be up to date, and a lot of times as simple as making sure that you're wearing the right size shoe. The other important thing is to check your feet on a regular basis. So keep an eye out for changes in temperature, color, if you're having any swelling, nail changes. Sometimes these things can be first signs of serious health problems such as diabetes, circulation issues, and even heart disease. So let's talk a little bit about heel pain. And I'm sure many of you have had heel pain issues during your life, whether it's through plantar fasciitis or something else. Plantar fasciitis is the most common reason for heel pain. It's caused by inflammation of one of the ligaments on the bottom part of your heel. The Achilles tendon is also a source of heel pain because it attaches right into the back of the heel. Stress fractures, obviously, you know, through overuse. A lot of people who aren't wearing supportive shoe gear, runners, and also people with osteoporosis commonly get stress fractures of the heel bone. And lastly, nerve impingement. So if similar to getting carpal tunnel in your wrist, you can get nerve impingement in your ankle called tarsal tunnel syndrome. And if you get impingement of that nerve, that can cause heel pain, numbness, tingling, and sometimes can mimic some of these other things. So what is plantar fasciitis? I'm sure you've all heard of it. The plantar fascia is a thick ligament that runs on the bottom part of your heel and actually spans all the way into your toes. The fascia supports your arch, and over time, whether it's through overuse or maybe you're recovering from injury or wearing the wrong shoes, I see this a lot of times in the summertime when people are walking barefoot a lot or wearing flip-flops. It can cause a lot of damage to that ligament. Over time, you know, if not treated properly, you can develop some small tears within that ligament, which can cause a lot of inflammation and pain. Typically with plantar fasciitis, you get this sharp shooting pain, especially after prolonged sitting or when you first get up in the morning. And then it starts getting a little bit better as you start walking. Sometimes people do say that it gets worse after prolonged standing or at the end of the day, but it's usually on the bottom of the heel. And like I said, after you've been sitting down for a while or when you first get up in the morning. Now, how do we treat this? Typically, you have to get going with a good home stretching and icing routine. Now, icing, I recommend getting a frozen bottle of water or a frozen can of peas and kind of rolling it underneath your arch into your heel. That not only decreases the inflammation through the ice, but also massages the fascia. The other thing is getting on a good home stretching routine, which we'll go over in a little bit. Arch supports, wearing good supportive shoes is helpful. So if you are dealing with this issue, you don't want to be walking barefoot a lot, especially at home on hard surfaces. So maybe wear some slippers at home and make sure you're wearing good supportive shoes if you're going out for a walk. And sometimes a night splint can help too. That's that picture on that top right. What that is it's kind of like a boot that you wear when you sleep that keeps your ankle stretched so when you get up in the morning, it's not so tight and painful. Sometimes with plantar fasciitis, if things aren't improving with all of these treatments, and you've gone through all of these home exercises, physical therapy, and it's just not getting better, sometimes we do a surgery for this where we go in there with a small camera and release that ligament. Moving on to Achilles tendinopathy. The Achilles tendon is the strongest tendon in your body. It starts where your calf muscle is and attaches all the way into the back of the heel. Sometimes Achilles tendon pain can cause heel pain, especially in the back of the heel or sometimes along the tendon itself. Once again, this is an overuse injury, usually caused by overactivity through exercise, maybe not properly stretching at home. I see this in a lot of people who are hiking or working in jobs where they have to go up and down, hills or ladders a lot. Wearing, inappropriate footwear, especially wearing really flat shoes. People with flat feet or high arch feet commonly get Achilles tendonitis and calf tightness, because if your calf is tight, it puts a lot of strain on that tendon. Over time, what happens with the tendon, if not treated properly, is same thing with the plantar fascia. You develop some small tears in that tendon, and it gets swollen over time. And if not treated properly, can result in a chronic non-healing tendon or eventual rupture. So how do we treat this? Generally, if it's really bad, I'll sometimes offload people in one of those boots that everyone hates to wear. But the important thing is to get into some kind of rehab program where you're actively strengthening and stretching the tendon. And we'll kind of go over that as well. It's also important to ice the tendon at the end of the day if you do have this injury, just to kind of help with the swelling, especially at the end of the day. Shoe gear and activity modifications obviously will help. You want to avoid wearing really flat shoes. I see this in a lot of soccer players because of the cleats cause the heel to kind of drop past neutral and stretch the tendon. So you definitely want to avoid wearing really flat shoes like that. Next, I'll talk about some strengthening and stretching exercises. This is, not only for the plantar fasciitis and Achilles tendon, but I think that you should try to do this on a routine basis just to maintain the strength, stability in your ankle for injury prevention. I always tell people it's important to stretch before and after exercise. If you're going for a run, going for a walk, especially after. People always forget to stretch after exercise, and that's important because after you exercise, your muscles tend to tighten up. So you really want to get on a good stretching routine after exercise. It helps with muscle soreness and pain the next day. A lot of patients ask me about heating and icing. I think heat is good before, especially if you're dealing with an injury and you're doing strengthening, stretching exercises, just to kind of warm up, but always ice after your exercise routine. Now, here's some simple stretches that you can do at home. This is just a basic calf stretch that you can do. I recommend this after a walk or run, or even before you get out of bed, just to stretch your calf. This especially helps with Achilles tendonitis and plantar fasciitis, especially right before you get out of bed. Just kind of do some range of motion with your ankle, get things moving, and then get a towel, pull back on your foot to stretch the muscle in the back of your leg. This is another way to stretch your calf. This is a simple wall stretch where you kind of lean against the wall. On the left side, there's two ways to do this. One is to do it with your knee completely extended, and one is to just put a slight bend in the knee. These two stretches stretch your calf muscle, but stretch different components of your calf muscle. So it's important to do both of them. The picture on the right is a modification of this where you can stretch your toes on the other side while stretching your calf. So you're going to do both sides, obviously. And the toe stretch is really good for stretching out your plantar fascia. On the left is a picture of someone doing something called a perineal stretch. The perineal muscles are a group of muscles on the outside of your leg and the outside of your ankle. Sometimes when people are recovering from, like an ankle sprain or surgery, they lose some of that peroneal muscle strength, which is a really important muscle for stability. So before you exercise, it's good to kind of do that stretch where you're seated with one of your legs crossed, and then you pull your foot up, which stretches all of the muscles on the outside portion of your leg. The picture on the right is a simple way to stretch your arch. So basically, just kind of in a kneeling position with your toes extended, you can see how that would really stretch the plantar fascia to give some relief if you are dealing with that. Some strengthening exercises. This is a really basic thing that I think is really helpful in strengthening your calf muscle, and also helpful in rehab if you are coming back from injury. I recommend all of my patients who are having Achilles tendon problems to do this. So basically, the picture on the left is someone doing a double heel raise. You're just going to hold on to something, try to do 3 sets of 10 or whatever you're able to do, and then progressing into a single heel raise. So you see the lady on the right side doing it with just the 1 foot. So make sure you're able to do the double before you do the single. And then once you're able to do both of these and you feel pretty good about it, then progress into something called eccentric strengthening, where you go up on both heels and then you let go of 1 foot and then slowly come down on the other. That's a really good way to strengthen your calf muscles and all of the muscles in your leg that help you push off. These are some ankle stability and foot exercises. So the picture on the left is basically you're just doing the alphabet. A lot of people coming back from ankle sprains, or if you just feel like your ankle's weak, this is a really good way to do the work on the stability muscles in your ankle, on the inside and outside of your ankle. The picture on the right just depicts doing toe curls with a towel, and that really helps with plantar fasciitis, and also just strengthening the intrinsic muscles, the small muscles in the bottom part of your foot. These are some exercises that you can do if you have a TheraBand at home. So on the top, same thing as before with the heel raises, where you kind of hold the band around your foot and push down. Helps strengthen your calf muscles. The second row of pictures is really important for ankle stability once again. So holding the band on either side of your foot as you kind of invert and evert your foot in either direction, which strengthens the muscles and tendons on the inside and outside portion of the ankle. If you don't have a TheraBand at home, you can still do this. What I recommend is just get a towel and kind of pull the towel in either direction and try to do like 3 sets of 10. If it's too easy for you, then you can get something heavy like a weight or a can of soup and put it at one end and kind of just pull the towel in either direction to kind of strengthen those stability muscles. These are some general recommendations if you are recovering from these injuries or just want to maintain good health of your foot and ankle. I think it's really important to get outside, especially now. Recommend 10,000 steps a day, which equates to about a little over 2 miles. Just getting out to exercise is good for your health and then improves your circulation and obviously helps with weight control. And the recommendation of 10,000 steps, if you can't do that all at once, it's not a big deal. That's just a recommendation for the whole day. So if you can do half in the morning and half in the evening, that's fine too. So moving on, I want to talk a little bit about COVID. And I'm sure you guys might have heard this 1,000 times, but what is COVID-19? COVID-19 stands for coronavirus disease 2019. It's caused by the virus, which is called SARS coronavirus 2. Primarily spread between people through close contact through respiratory droplets. So that's through your nose, mouth, and eyes. So that's why it's so important not to try your best to not touch your face because you don't know, what's on your hands or what surfaces you've touched. Symptoms can vary quite a lot with this pathogen, so this is why it's so hard for us to mitigate and get this under control, because unlike previous epidemics with the first SARS in 2002 and MERS in 2012, those, everyone got sick and everyone who was affected had really bad symptoms. This caused quite a lot of varying symptoms, from asymptomatic to very, very sick people needing ICU care. So it's very hard to kind of get this under control because of that. These are just the typical symptoms, which I'm sure you've seen. The main things being fever, fatigue, dry cough, and headache, sore throat. And a lot of people, if you do have this, certainly you're reaching out to your primary care doctor. But when does it get to the point where you should go to the hospital or you should get higher level care? Certainly you want to try to avoid the hospital as much as possible. But if you are having difficulty breathing, shortness of breath, you feel like your lips or face changing kind of like a bluish color, chest pain, altered mental status, confusion, extreme fatigue. These are signs that your body's not getting enough oxygen, and it might be better for you to obviously contact your primary care doctor, and then most likely will need higher level of care. Now, something interesting that I wanted to bring to your attention that came out about a month ago. A lot of these new reports are, especially out of Europe, they came out with a bunch of studies showing skin changes, especially in the foot and ankle with COVID-19. In fact, one study, I think it was over 150 patients that they looked at, about 20% of them had some kind of cutaneous manifestation as a result of the virus. What they don't know is what the skin changes have to do in relation to the prognosis of the virus, or when it develops, whether it's on the onset or delayed, because it's happening at any point. But certainly important for you to keep an eye out for. If you do have some discoloration of your toes, kind of like this, where it turns into bruising, some people are having quite a lot of pain from this without any injury, and these discolorations can turn into blisters sometimes. And like I said, a lot of patients are complaining of quite a lot of pain with this. Sometimes people can develop rashes or hives that kind of spread up the leg into the thigh, without any kind of contact or allergy symptoms. So these things are important to keep note of. If you do have some mild cold symptoms or something, but then you start noticing skin changes in your lower extremities, definitely worth letting your doctor know about that. So what I want to end with is, and I'm sure you've all heard this a million times, first of all, social distancing is important. And the main reason for that is to try to mitigate this virus, and to make sure that this doesn't get out of control and overwhelm our health system. And that way, the people who do need help are able to get help. Wear a mask. If you're going outside into a public area, you're going to a doctor's appointment, you're going grocery shopping, wear a mask to slow down the transmission. Wash your hands routinely. I do see a lot of people wearing gloves, and I think that's fine to do, but you have to be careful, because I think wearing gloves gives you a false sense of security, but you really have to be careful with what you're touching with the gloves, especially your cell phone keys. If you're going out shopping, make sure you wipe some of this stuff down and take your gloves off and throw them out immediately when you get home. Wiping down commonly used surfaces, like I said, a lot of things that you touch on a daily basis that you don't think about, like your cell phone, keys, steering wheel, these things you should probably wipe down on a routine basis. And the last thing I recommend is just take a break from the news and social media, because there's a lot of negativity out there, and just for your own mental health, Because it's out of your control, take a break from that. You know, call a friend, talk to a family member, FaceTime with people you haven't talked to in a while. And like I said, go outside and exercise and do some of the things that we've been talking about. The office, you know, we're all here if you need. If you have some injury or concern with your foot and ankle or some other part of your body that you feel like you want some expert advice, or you have an injury, we're definitely open to see you. If you're concerned you don't want to come to the office, we do have telemedicine as an option, which is obviously much safer. So we can communicate you via like FaceTime or Google. Okay. So I'm going to just open it up to questions now.
Dr. Shu, we do have a question from Susan. It says here, if my ankle pain may be due to arthritis, should I see an orthopedic doctor or a rheumatologist?
Well, I think that I don't think that it hurts to go to the orthopedic, but if you do have underlying rheumatologic problems, I think that you have to kind of see both, because first of all, to see how bad the arthritis is and what your options are, whether you're still a candidate for maybe a cortisone injection or some other form of treatment, that would be on the orthopedic side. But then trying to get the systemic inflammation down in your body is more from the rheumatology side. So it's definitely a group effort to kind of get the pain under control.
Were there any other questions from anybody? If it's easier to unmute yourself, we could do that too. We just don't want everybody talking at one time. Elizabeth has asked if we can get a copy of the slideshow. What I can do, I can put my email address in the message right here. And Dr. Shu, would that be a problem if we send out your presentation?
Not at all.
Were there any other questions tonight? I'll give it another minute or so. People may be typing.
Okay.
All right, so if you're interested in the slide, the copy of Dr. Shu's presentation, just send me an email and I can get that over to you. I did put my email in the chat box. But if there's no other questions, I think we could go ahead and end it. Dr. Shu, thank you so much for your time and the wonderful information that you provided to us tonight.
Thanks, Christina, and thanks everyone for coming. Be safe, okay?
Thank you, you too.